Pubs and restaurants are banned from selling alcohol in Wales as new rules to tackle the spread of coronavirus in the country start today.
The government says it's making the move to prevent deaths from the virus, but it's angered the hospitality industry, who say many businesses just won't survive. Some researchers are also sceptical the restrictions will make much of a difference. One of them is Robert West, an emeritus professor of health psychology at Imperial College London. Good morning to you. Thank you for joining us. So maybe you can explain to us why you think this ban won't work.
Actually, it's UCL, University College London.
Apologies.
But, that's OK, don't worry. I think this issue has been looked at. Obviously, it was looked at also when the 10 o'clock rule came in England. And I don't think it's necessarily a case of saying that, we can be confident it won't work. But I think what we really do need is clear quantitative estimates of what the impact is likely to be on the positive side in terms of getting the infection rates down, but also a clear indication of what they think the impact will be economically on the pubs and bars. Now, I have to say that up till now, I've been very impressed with the way the Welsh government has handled this, and the Scottish government as well. I think excuse me, they've listened to the science very well. This one is a little bit surprising to me because it's from my reading of the science, as it were, it's not clear to me that this would have been the best approach.
No, and do you think that there's going to be the compliance with this? Are they going to be able to take people on board with it? Because, people getting in touch with us today seem frustrated by the situation, and actually the pubs and bars that have taken a lot of measures to make sure that their premises are COVID safe are feeling that actually they'd be in a better position to make sure that people are socially distancing and drinking responsibly, rather than the alternative, which might be for people to think that they'll do it in their own homes or in gardens or elsewhere.
Yeah, that's exactly it. I think that, I've been impressed with the way that the hospitality industry has responded here, and many of them have done a terrific job in making their premises as safe as they can be. I think the risk, obviously, and this is, I'm sure, what the Welsh government are thinking of, is that when you put alcohol into the mix in any situation, you get problems with disinhibition and so on. But again, as you say, the issue really is if you're going to have off sales allowed and people will be, probably will be drinking. The question is, where will they be doing it? And I think there probably are other solutions in terms of, for example, making sure that you can have use of alcohol outside of the premises, but still in a controlled environment. And we know that the infection rates are much lower outside than inside. But I think the key here, and this is really where the compliance issue comes in, is to make really clear to people, what the science is that this is based on, what the estimates are, and to work with the hospitality industry so that they understand, and to make sure they're adequately compensated, because many of them are really feeling the pressure financially.
Undoubtedly, the reason they have taken this step is because they believe that the spike in cases in Wales is such that they have to take drastic measures. And, of course, the ultimate part of all of this is that people's health is more important. That's the bottom line, and keeping people alive. So, whether they publish the information that they've had or not, we've got to trust the Welsh politicians to be making this, because they understand that more people are going to survive and the health of their nation is going to be improved by taking a measure like this, as drastic as it might seem.
Yeah, well, you're absolutely right. They do need to do something. I mean, the fire break that they instituted did work. It brought infection rates down, but unfortunately, the virus has remained what it is. And as soon as you start to get mixing again, then you get the infection rates starting to go up. So they definitely need to do something. I think it's really a question of what the best thing to do is. And once you've decided what it is that you're going to do, to make sure that you're very, very transparent about your decision-making process and the estimates, the quantitative estimates that have gone into that. I think that's the key. And if they can do that, then I'm sure people, they won't like it, but they will go along with it.
OK, well, thank you very much for joining us this morning. Let's put those thoughts to a Welsh politician who is at the heart of all of this, of course, because they are hoping their ban will bring the rate down. Robert's West points we're going to put to Vaughan Gething now, who is the Health Minister of Wales, and joins us this morning. Good morning to you. Thank you very much for getting up to talk to us this morning. As you can imagine, we have been inundated from our viewers in Wales who are very worried about this, not least if they work in the hospitality industry, but also the reality of what this means for them. One of the key points that we were just hearing there was if you publish the data that proves what you're doing is going to have the impact that it's going to have and what that means economically, then the people of Wales will be much more compliant and they will go with the rules that you're putting into place. Is that something that you can do for them so they can understand exactly why you're making this decision?
Well, we have already published a range of data and information supporting the choice we've made, and we'll publish more over the coming days as well.
But I think
So
what they're saying is the specific economic data. I know that you've talked about a report that was done by Sage that says there is a correlation between the hospitality industry and the spread of the virus, but the specific actual numbers so people can really genuinely understand the minutiae of this.
Well, what we publish every day are the case rates, to show that case rates are going up after the fire break. What we published yesterday was a report from our technical advisory cell, effectively the Welsh Sage Committee. And again, that reiterated that effective measures to control the spread of coronavirus in the UK are Tier 3 equivalent measures in Scotland and England. And the big difference between Wales yesterday and Wales today in those Tier 3 measures were indoor entertainment venues and the restrictions on hospitality. So we have the same restrictions now that Scotland do in their Tier 3. And your viewers who live in England will be familiar with the fact that in those areas, hospitality is closed and is takeaway only. So these aren't new measures within the UK, they're new measures for Wales, and they are based on the evidence of what works. We're publishing more evidence about the direct impact the hospitality appears to have. And this isn't about blaming the hospitality sector, it's about the behaviour of all of us when we use hospitality venues. And we face this awful choice of doing nothing and seeing our rates increase and more people not surviving, or doing something like this, as your previous contributor said, to do something, and doing something has a real harm that comes with it as well. There isn't a consequence-free choice to make, but in the balance that we have to strike, this is what appears to be effective within the UK. There's evidence supporting that, and that's a choice that ministers have made. And I don't expect people in the hospitality sector to welcome this, but I hope they'll understand not just the difficult choices we have, but the responsibility we have to act to keep Wales safe.
Because it will be tough for them, won't it? You know, financially. I mean, we've had people who own pubs in Wales getting in touch already to say, you know, they've gone above and beyond to make sure that people who use their premises are safe. Is there a worry that by doing this, you will take people from using a managed environment, using a pub where it's all been cleaned and there's supervision of what's going on, and you'll drive them into homes, into places where they'll then be drinking and mixing with people as a consequence? Because, you know, they can still go and buy alcohol in supermarkets, can't they?
That's true, and that's the same for Scotland in Tier 3 and England in Tier 3. About 40% of England is in Tier 3. So we know that it's possible to shift drinking behaviour into different areas. And yet we also have this evidence that this is effective. And the challenge is you don't ever get a perfect policy response because some people will behave in different ways depending on the rules. We want the great majority of people to buy into the fact that we all need to look at what we should do. So we ask people to be responsible, to recognise the significance of the threat that we face. In 20 out of 22 local authorities in Wales yesterday, the rates went up. That's urban Wales and rural Wales. We see a rising tide of coronavirus. We have evidence of what appears to work within the UK to suppress coronavirus to help save lives, and that underpins a choice we've made. It's also why we've got a £340 million package to support businesses affected, because we know there's an economic hit. That's in addition to the measures the UK government are taking. Those are choices we've made in moving our budgets around to support businesses that we know will be hard hit. And I don't shy away from the fact, and I won't pretend this won't have a really significant impact on those businesses, at pretty much the worst time of the year for them as well. And I really do recognise that. But if we don't act on the evidence, then I'm afraid we won't be meeting our responsibilities to keep Wales safe and to keep people alive.
OK, Vaughan Gethin, we're going to have to leave it there, but thank you for joining us this morning. Thank you for all the messages that we've had as well. Lots of people saying, Lydia saying, Wales has gone too far, restricting alcohol will encourage house parties, as you were saying, Charlotte, over the Christmas period. There's no track and trace in a house party. There is track and trace in pubs. Andy says, I live in North Wales, very low comparable rates to South Wales. We have no tiers in Wales, but we all have the same restrictions. The measures in place in pubs are brilliant. What harm is a glass of wine with a meal? This will force drinking into homes. It's poorly thought through.
And Alison makes the point, we live close to the border. We're able to travel to Tier 1 and 2 areas in England for a meal with alcohol, yet we can't go to our local and do the same there. It doesn't make sense. But thanks all of you for getting in touch this morning.
Should point out Larry as well. A few of you coming in saying you think it's a good idea. My partner is a chef. He'll be off work now until mid-January. Even so, I think the Welsh Government is doing what is necessary to keep people safe. The numbers have stayed fairly low in Pembrokeshire, where we are, but we need to keep it that way.
It's all about tackling those figures, isn't it?